Okay, so what we're going to do is breathe in through the nose slowly. And then at the very end, then just do a real quick breathe in, like breathe in real quick. And then when you breathe out through your lips. So here goes. So breathe in. We'll breathe in. And breathe in. And as we do it, let's do that bit where you just notice your breath. So just we'll just put a lot of traditions have the noticing your breath way of doing things. So here we go. We'll do one more. How did you guys like that one? So there's a little mudra, we're used to all these other little mudras that we do. This one is one just like this. And I'll share the screen to show you, let's see, no, not that. Let's see. Here we go. I'll show it to you. So just that. And there's a little figure eight motility, a little rhythm, and aorta can be a joint. The liver and the kidney can be a joint, the liver and the gallbladder, the liver and the rib cage. So it's the liver and the diaphragm. There's things that are next to each other, and they should be able to move in all directions. So this starts to get that mobility. So try that, and then we can do it on a couple of different spots. So let's do a little bit to start with for physical healing, and also it's very meditative. And so you know how you have the top of the breastbone, just put part of your thumb right on the top of the breastbone and just touch super light, that super light butterfly touch, and then super light bring it up, and then take your hand still with your mudra and just put it at the base of your head and just below the base of your head. So my thumb is just right on the base of below the base of the head on that soft part of the neck, which is those two spots that we talk about. And then just touch that and then bring that up to the ceiling. And let's hold this for a little bit. It goes so quickly to start to shift things. And this one is to improve the ligaments in the body, which are your guidance for your joints, to make sure they have the right guidance. They move just so, but not too far. And on a process level, it's for your inner guidance. They work through those little Pacinian corpuscles just under the skin, and the spinal thalamic tract and the spinal cord, and the thalamus in the center of the brain, which is the seat of consciousness and perception. So it's very deep, and the way you access it is just super light touch, very light touch, and the kind of touch that if you touched any less, you wouldn't be touching. And you just touch that upper breastbone, touch that upper neck, the very top of the neck before the head, and then push them up slightly towards the ceiling. Woo. And we're going to activate a little bit more. There's a motility, a little rhythm that happens in the body. So you can put your hand in the back of your head on top. And even if you don't know exactly where it is, you can think about the pineal gland. There you go. It's in the back part of that center of the head area. They call it the third eye. And there's a little rhythm that happens that goes from that little pineal gland to the maxillary sinuses. So you can think of it like a little triangle, and it's kind of like a seashell, like a nautilus. It's a little on the top, and then it widens here. It's kind of like the yin and yang symbol, and it just it moves like this. It goes down and forward, and up and back. And if you can't feel it, that's okay. But we're activating very deep rhythms in the body. It has to do with the mathematics of the universe, the Fibonacci sequence. It's the fractal code. It's like the Milky Way has that Fibonacci sequence. It has that spiral, and a hurricane has that, and the snail's shell has that. Seashells have that. It's that certain curve, and so it's got this rhythm that does this. And there's another one from the top of the breastbone. So remember that super light touch, and it goes to your gallbladder on the right, and your gallbladder on the right, and your spleen on the left. So it's another one that's like a nautilus shell that goes forward, rolls forward, and then rolls back. And rolls forward, and rolls back. And with this little mudra, it's called a Mushi mudra, which improves relationships, like relationship between the heart and lungs, relationship between the femur and the tibia, relationship between any structures. Ooh. And then there's another one that's at your belly button that goes to the right lower belly, the ileocecal valve, and the left lower belly, the valve of Houston. So it's like it goes to the colon on the right and the colon on the left. And so from the belly button is the little point, and then the right side colon area, the valve of ileocecal valve, and the left side valve of Houston is another seashell, and it's also rocking. And we're using super light touch. And then we can activate your hips. So right between your, right the crease of your, where you would sit and you have a crease, you would feel your pulse if you wanted to feel your pulse, but it's right in that center part of that crease. You can feel, that's your hip joint. And there's a little reflex point in there for joint space. So it's like you think of the joints have to be able to move equally well in all directions that they're supposed to move in, and it's supposed to have your ligaments for guidance, and there's ideally a good amount of space, and in that space is quanta, is energy. And let's move the top hand a little bit more forward, just on the very top of the head. And there's a little joint in the very center behind your eyes. It's between the bone that makes up your temple bones, your sphenoid bone, and the back of the head bone, the occiput. It's called the spheno-basilar junction. And right above it sits your pituitary gland, which is, the controller of, it's where hormones are made. Hormones are, so, we want that spheno-basilar junction, that joint, to work really well. We want the relationships between the bones and the pituitary gland, and the optic chiasm for the eyes sits there, and the cavernous sinus sits there, which is also called the seat of consciousness. Big vein structures, sinuses. And so we want this to move really well and have good relationships, because then your pituitary has a better home and it can make more optimum hormones. And that sella turcica, which is what it's called, that little joint, is the home base for joints. So when you're thinking of that center joint, I'll show you a picture of it. You can just kind of put your hand on top of your head with the little mushi, and then connect this other hand with the little mushi to any joints. And so your hip joints are really good because that reflex point is for joint space. So this is a way just to go work on yourself. And you might feel that little rocking motion, that forward and backward rocking motion. That's part of the mathematics of the universe. And then if there's some part of you that's calling you that's like not moving, or that's stuck, or that's just somehow like, oh, there's something there, you can just pay attention to that because that gives you some information, because that's where the little restriction is, that could be a root cause of problems. And we'll get to it. And so with the top of the hand, the head on the top of the hand, the other hand can go either like this or like this, but just on that low, low, low back where the dimples are. And that's where your SI joints are. And so you can just unlock the SI joints, the top of the hand. The head on the top of the head is on that sella turcica, spinobasilar joint, pituitary area. The bottom hand is on those little joints. They connect your sacrum, your low back, to your ilium, the big pelvis bones. You can feel for that little rhythm. And let's do one more. This one is the golden heart. So you can put a hand on top of your head, just kind of like about an inch above your head, half an inch above your head, somewhere in the center, and the other hand on your heart. I'm going to go like this. And so you're touching the skin over your heart, and just think of your golden heart. And this is very, very healing. So if you did one thing, if you want one thing for healing, is to connect your heart, like touch your heart, and touch just above the top of your head, like hovering above your head. You would want to put pillows if you needed to support it for a while. And if you just do this, it's very healing for the whole body. The heart is for healing, and the space around the heart, like just off the heart, between the heart and the covering of the heart, there's a fibrous sheath that covers the heart. And in that space between the heart and the fibrous sheath is what we call the golden heart. It's got golden heart energy. It's got a gyroscope kind of activity. You can feel for that little rocking, and that's healing. And then if your attention is called to some place like, oh man, I feel it in my pelvis, or something is, I'm noticing something somewhere else in the body. If you just put your attention on what you're noticing without trying to change it, you could just notice it. And it's the power of attention. People say the power of intention, but it's also can be thought of as the power of attention. Where your mind goes, energy flows. So with this hand on the heart and the hand above your head, you can use the power of your mind. In Qigong, they call it yishi, the power of your mind to notice what you notice, stay out of your thoughts, stay in your body, and just notice. And so this one technique is the golden heart. It's the way with the new integrative manual therapy, what we're using. It's the first thing that we kind of start to, we do our mapping and we see what's going on and where the primary problems are. And then we go and put the hand on the heart and the hand just above the head and spend a little time noticing that space between the heart and the covering of the heart and the space above the head. And we just hang out there. And the body starts to notice. And then with our skills, we can notice, okay, well, here's an issue here, here's an issue here, here's an issue here. And then just noticing it really starts to heal. Yeah, and if you need a little more, the next level can be leave your hand on your heart and then put the other hand wherever you were noticing. And the power of attention. Where your mind goes, energy flows. So just notice where your mind goes. Stay out of your thoughts. Stay in your body. Ming Tangu and also Sharon G. Mateo would say something along the lines of when you're thinking of healing, it's good to go through the body. And what that means is it's good to get your physical body, the structure, your temple optimized. Like the foundation has to be good. The framework has to be good. The roof has to be good. The walls have to be good. And then it's like any house. If you've got a house, a 1930s house, you want to check the foundation and get it good. And you want to make sure the wood is good and everything is lined up and the roof is good. And then you want to check the plumbing and check the electrical. And when it's all good, then you can turn the power on. Because we have, a big power grid, and a house that was built in the 30s isn't made to have high-level computers running through it and super high conductivity of electrical stuff. But if you upgrade it, then it can handle all the new information. And so, man, this is great, you guys. And with the IMT, there's all sorts of processes, techniques, things to find and then go do. And for us, I'm going to do it in a matrix way, a Yishi way. And go right here, and let's find your primary physical finding and your primary spiritual finding and your primary mental and emotional. And then the primary of all primaries. Primary of all primaries, the one that shifting that shifts everything. And then with that point, we're going to fix it up. And then we're going to use the new IMT and go through and find the book that would be useful. So let me just find that. There it is. And then we're going to find the chapter 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. It's chapter 9. The book, the chapter. Do I need more information? I feel like I want more information from that, but we'll get it in a second. Yeah, the chapter 9. And which section? 1, 2, Akashic records. 1, 2, 3, 4, 5, 6, 7, 8. So 9.8. Whew. And I do want to find which one we're in. This will be fun and good. Let's see. IMT. Let me find this in Finder. New IMT. And where's diagnostics? Here we go. Okay, here we go. Okay, so we're going to use this. And even though you don't understand this, it's okay. We're just going to put it into the field. And immune system, killer T cells, 9.8. 9.8. Immune system. Do I have an immune system 1? Okay, so I don't have the immune system class, but I have, we can go to it. So we're 9.8. I need to make this happen. So let's hook up your thymus. So the Bushi point, the top breastbone area, and the heart. And we'll activate this immune system healing for you. Whew. Okay, let me just turn all this off now.